At Oakwood Healthcare System, our credo is patients come first. That's why our surgical teams are dedicated to using principles promoted by crew resource management, such as teamwork, enhanced communication, and standardized protocols and processes to promote high-quality clinical care and exceptional patient safety. One of these is the Universal Protocol, which provides the surgical team with key information checkpoints during pre-op, prior to the start of surgery, and immediately following surgery. In the next few minutes, you will learn how the Universal Protocol is to be administered for each patient, and you will have a better understanding of your critical role in the process. In this way, we can all work together to ensure our patients receive the best, safest care possible, each and every time. Upon arrival, the POHA nurse greets the patient, family, and/or support persons and performs the pre-procedure verification by asking the patient to state his or her name and date of birth.
If I may, can I see your ID band? Could you spell your
If the patient is unable to do this, a family member or representative may do so. The nurse checks this information against both the chart and the ID band.
I'm going to be taking you back to get prepped. That will entail some paperwork and IV, that sort of thing. If you'd like to wish him well for good measure, go ahead and do that, and we're going to get going.
The nurse then asks the patient to state what procedure is being performed today and on what side or site this will be done. The nurse then checks this information against the chart, looking for discrepancies.
Okay, Mr. Smith, can you tell me what procedure you're having done today?
Right total knee replacement.
And who is doing that for you?
Once verification is complete, the nurse informs the patient, family, and/or support persons that the surgeon will arrive to mark the intended site.
Dr. Bergeron will be by to mark the site, so if you have more questions at that point, you'll have an opportunity to ask. Right now, I'm going to have you look at the consent, make sure it's what we talked about, and have you sign right below.
As the patient is being prepared for surgery, there are two critical processes that must take place before the patient enters the operating room. First, the surgeon verifies the patient using the ID band and the chart, confirms the procedure with the patient, and discusses any patient concerns.
Let me just check your name. George Smith?
Yes, sir.
Okay, tell me your birth date.
January 1st, 1949.
Okay, great. All right.
After this verification step is complete, the surgeon will mark the site of the surgery with a special one-use ink pen.
I'm going to mark this just to verify for all the members of the operating team that this is the correct side. Okay? Great. All right, I'll see you back there.
All right, sir.
You take care.
Thank you. Mr. Smith?
Second, the anesthesiologist and/or certified nurse anesthetist arrives at the bedside and repeats the verification process with the patient and family. Again, the anesthesiology team checks for discrepancies throughout this interaction.
And your allergies?
Penicillin.
Okay.
The pre-op nurse meets with the CRNA and the patient to confirm key information by examining the patient's ID bracelet.
Can you tell me your whole name and birthday?
George Smith, January 1st, 1949.
And you're just allergic to penicillin?
Yes, ma'am.
Cross-checking the information in the patient's chart.
You're going to do a right total knee?
Okay, with Dr. Bergeron?
Yes, ma'am.
Okay.
Did he sign your leg?
Visually confirming the surgeon's mark on the correct side or site.
I think Larry was our pre-op nurse.
Hi, Mike. Hi, Corey. I think you've met Mr. Smith. This is George Smith. He's having a right total knee arthroplasty with Dr. Bergeron. He's got a penicillin allergy, so accordingly we started a gram of Vanco at 11:10.
Verbal confirmation of information by the pre-op nurse and verbal confirmation by the patient.
His blood sugar was 140, INR was 1.0. He's on Plavix, but that was DC'd a week ago. He's also on low pressor. His last dose of that was at 6 this morning. He does have a type and screen. I verified that with blood bank. Their family's already been back to see him, and no other special information to convey. Do you have any questions?
Only once these processes have been completed successfully and all information has been verified, may the patient be taken to the OR.
Okay, thanks, Larry. I think we're okay to proceed then.
Great.
Teams function more smoothly when the staff's names are clearly displayed in a prominent place that is accessible and visible during surgery. Each team member should record his or her name and pager number on the whiteboard. Completing the bottom portion, with information about the procedure and patient, will be the primary responsibility of the circulator. All team members are encouraged to verify the accuracy of that information.
Can you scoot on over to this bed here?
Once the patient has been brought in, a mini timeout will be called prior to the patient being prepped. This is to be led by the circulator and will involve the anesthesia team, first assistant, and scrub nurse. The circulator will have the patient chart open to the signed consent form. All must have a clear view of the patient's ID band.
Let's do the mini timeout.
Okay.
This is George Smith. Birthday January 1st, 1949.
The circulator will double-check the H&P found in the patient's chart.
So here's the consent, and the H&P also says right total knee arthroplasty. Dr. Bergeron has marked the site.
Then, the first assistant will expose the surgery site for visual confirmation of the surgeon's mark.
Help me out, thanks.
Once the staff has confirmed this information, it is time for the surgeon to lead the timeout briefing. The timeout briefing script will be posted on the wall of each operating room in a visible, accessible area.
All right, let's begin our timeout. This is George Smith. I'm getting ready to do a right total knee arthroplasty. He suffers from hypertension, diabetes, and osteoarthritis.
Check. We've given 1 gram of Vanco at 11:10. He has an allergy to penicillin.
The right leg is marked.
As the surgeon leads the timeout, team members must confirm the patient information that was verified during pre-op. At the close of the timeout, the surgeon will ask if anyone has any concerns.
And the implants are here and sterile.
If anybody has any concerns at this time, please speak up.
The goal of the universal protocol is to ensure a safe, effective surgery each and every time. This only works if each team member takes an active role in confirming the accuracy of the information and speaking up if anything is not as it should be. All team members are empowered to use this opportunity to report anything they have observed that may impede the surgery or harm the patient, without fear of retribution. The safety of the patient depends on this honest feedback.
No.
We're all set.
Timeout is complete.
Check.
Check.
Once all team members have verbally agreed to the completion of the timeout, the surgery may begin. Once the surgery is complete, the surgeon leads a final debrief before the staff leaves the operating room. The script for this debrief will also be posted prominently. The debrief will include comments from all team members, beginning with the scrub tech and ending with the surgeon.
All right, if this is a good time, I'd like to conduct a debrief. What did we do well?
This check-in allows the team to evaluate what went well and what could have been improved, and establish any actions that must be taken post-surgery to improve the process for the next case.
All right, good. Would you give me a follow-up report on the status of those osteotomes?
I will let Rick Turney know.
Thanks.
The 3 phases of Oakwood's universal protocol, during pre-op, immediately prior to surgery, and immediately following surgery, are designed to give all team members an active role in delivering safe, high-quality care. The universal protocol must be followed carefully and thoughtfully for each and every patient. Your dedication to this process will help ensure that patients come first at Oakwood.